Morning, everybody. Almost everybody.
Good morning.
Morning.
Okay, everybody's here.
We're having a little bit of Wi-Fi issues, so if I drop off, it's because I lost that, and I'll try and get back on.
Okay, all righty. Good morning, Commissioner Kula. Morning, everybody.
Good morning.
Okay, looks like everybody's here. We can go ahead and get started. Good morning, and we'll call to order the Yamhill County Board of Commissioners formal informal session for January 6, 2022. And Ken, would you lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll begin with the calendar session. Is there anything else to add to the joint calendar?
Here, I think we have, I believe we got an email for the replacement for Senate District 15 or 16, Betsy. I'm trying to find it here.
Correct. That's for January 14th at the Columbia County Courthouse for District 16.
9:30 to 11.
Okay, and then I think if
Yes.
anybody's doing anything there, but
Legislative Committee is Monday.
Monday.
AOC Legislative Committee is Monday. And I think that's it. Okay, great. So if there's nothing else, we'll go on to the consideration of the Board of Commissioners election of officers. And this is something that we do every year, and the chair position rotates, as does the vice chair position. And so the vice chair moves up to the chair, and then the commissioner who wasn't vice chair moves up to vice chair. So at this point, where we are at is that Commissioner Bershauer would assume the chair position, and Commissioner Kula would assume the vice chair position. So I'd like to entertain a motion to move the chair position to Commissioner Bershauer. Do we need two separate motions for the chair and the vice chair, Ken?
I believe you could do it. I think it's up to the board. You could do that in a single motion, or you could do that as two motions. I think it's up to the board.
Okay, so let's go ahead and just do it as one motion, and that would be for the chair position for Commissioner Bershauer, vice chair position for Commissioner Kula. Do we have a motion to that effect?
I move that. Well, I guess we're under the we're moving vice chair, so I would move that we approve.
Okay, motion. We have a motion. Further discussion? All right, hearing none. All those in favor signify by saying aye.
Aye.
Aye. The motion passes, and Commissioner Bershauer is now the chair of the Yamhill County Board of Commissioners, and we will hand the proverbial invisible gavel over to you.
Thank you very much. I have some big shoes to fill, so thank you for all of your service over the past year or two. So.
Thank you, Commissioner. Chair.
Okay, so we are moving on to item E, public comments. I don't believe we have received any as of this morning. So just for those watching, we are still accepting public comment through our email, which is BOC info, and you can find that on the website. But for now, that's the only way we're accepting public comment. Item F is a work session. We have one item, review and discussion of the 2022 Yamhill County Board of Commissioners areas of liaison and responsibilities. And I guess I'll open up the discussion. I feel like the past year's been it's been a bit strange with COVID, and you guys have had 2 years of this now, so it's been challenging in many ways. And having 1 year in, I kind of feel like there's areas where I really was able to dive in a lot, and then there's areas where I haven't been able to. So my instinct would be to maintain the lists that we have and the committees and that we have, just because I feel like I would like to spend a little bit more time on some of them. And we've just been pulled in so many different directions this year. So that would be my instinct. How do you guys feel? Commissioner Kula?
Thank you, Chair. I'm by the end of the meeting, I'm gonna have this down. I was looking over and thinking about the areas that I've worked on most, and kind of areas where I know you've dove in deep, and areas where you just haven't been able to because of COVID. And I think there's a good balance for me of areas that I'm still like feeling new to, and areas that I have deep knowledge of. And I look at, especially Commissioner Burschauer, or Chair, I look at yours and I'm like, oh yeah, there's things that you know a lot about. And then there are areas that you're still new to as well. And I think that that's good, honestly. I think that's valuable for us. Now, Commissioner Stuart may obviously feel differently about her responsibilities, but she has a long time experience in many of them.
Yeah, I agree. And especially with HHS and I see value in having some consistency there, through the pandemic, as we hopefully enter the endemic stage here soon. So just all of your institutional knowledge with that department, I feel like there's value in maintaining at least for another year. Commissioner Stuart, what are your thoughts on that?
Thank you. I appreciate that. Yes, the Health and Human Services is an enormous department, and there are so many different facets to it. And also you've got the components of the Board of Health and all the other components that go along with that liaison duty, like Housing Authority and YCAP, and being on the board or liaison to the board of those. So I think to remove that is to then remove a commissioner who's been on a board for a number of years. And I just look back to Commissioner George, and Commissioner George pretty much handed a lot of these things to me and had been on them for a number of years herself. So it just really takes an awful lot of years to get involved in all the different aspects. I would very much like to continue in that. There are some changes under the list of liaison duties that are no longer applicable. So I'd like to make note of that. For instance, the DHS Foster Parent Champion Committee is now the Family Wellbeing Council, and the Affordable Housing for Homeless Task Force, that one would come off. The other thing that would come on is the Newburgh Urban Area Management Commission, which was a commission which was just pretty much on the books, but for 12 years we didn't meet. It's been reconstituted of sorts this last year, and we have new board members, and so I would like to stay on that. That's not listed here. And the other thing is because you've got Mental Health and Developmental Disability Advisory Committee and all of those. So I would just like to make those changes, but other than that, my hope would be able I would be able to stay on those.
How about Chair? I'd say that I think that's good. Commissioner Starrett, I think that's perfectly reasonable. The one thing that I would offer is that, when Commissioner Starrett was chair, she had HHS and then a long list of chair duties as well. And if there's anything from Commissioner Burschauer, or Chair Burschauer, your existing list that you are like, because I'm going to be liaison to finance and HR and admin, that you are like, well, I don't think I have time to do that justice. I'm happy to take one of those on, or two of those, however.
Okay, yeah, I appreciate that. And then Ken, can you guys not hear me?
Yep, we can hear you.
You can, okay. I don't know what is going on with my computer, but Ken, are there certain positions that must go with the chair? So we're going to be moving them anyway?
Correct. There's the chair serves as the liaison to county council and county administration, even
Right.
though that's, Christian and I meet with individual commissioners on a regular basis, and we have that. But again, there are some areas under administration, including because emergency management's another one that usually goes to the chair as well. But I think I'm trying to remember, because I think that's a holdover from when emergency management was still under admin and not under the sheriff. So, if you look at the list, you'll see that there's some edits it will make, and it's really primarily around the county administration and county council that'll move over with the responsibilities of being the chair. The other thing that I would highlight too is typically when we're looking at areas of liaison, there's kind of the three big areas that are involved: the criminal justice, HHS, and then I really call it more land use, because it's really planning and public works is the third big one that comes with that. And so, if there's consensus that the board would like to proceed with keeping those big three, I think what might be helpful for staff is take a look at some of the, I think the ones that get to be challenging at times is like the various AOC, NACO, workforce partnership. So, there's some of those other ones that it'd be helpful if you have edits or changes that the board would like to see on some of those designees. We can put together the final document, what that's going to look like, and we could bring it back next week for the board to take action on the actual areas of liaison.
Thank you. Commissioner Stuart.
Thank you, Chair. A couple of things. I just had a question about the Willamette Falls Lock Commission, and that's Locks Commission, and you are, Chair, applying to be a member. How is that? What's the status of that?
I have not applied to be a member.
Okay.
I'm not sure why that's on there.
Okay, because I think that's an appointment, if you will, based on an application.
Okay.
So maybe we can find out more about that.
Correct. There's previously, because that is an appointment, that's not one that's just set by the board adopting the liaison. There's an application and a governor appointment to that commission.
Okay.
That needs to occur. And I believe that has been a holdover, because I want to say that Stan and Rick, in the past, and that it was a holdover on those areas. So if that is still something that we would have to apply for and make that appointment. That way, if that's something we want to keep on the list and make sure that there's a liaison to that, it's more than just having the liaison. There's that appointment process as well.
Okay.
Another
That was right
question.
before you said?
I believe so.
Okay. Commissioner Starrett.
Oh, just that I noticed veterans is under Health and Human Services, and that has been removed. And the reason we did that was because we had a veteran, and it was Commissioner Olson, and it just seemed more appropriate. So I don't know where we want to put that.
We moved it, Commissioner, we did last year back under HHS. I'm looking at the current list right now, and I'm seeing it listed under Health and Human Services because Veteran Services is within that department.
Okay, so it's back there now.
Correct.
Okay.
So Commissioner Kula, do you have any interest in serving on the Locks Commission?
Chair, I certainly would be, I would be happy to. It's a group that, well, I will say that I have a vested interest and probably even a potential conflict of interest around it. But I think that's probably stretching it, being a resident of the river. But it's a it's a slow moving process to rehabilitate the locks and get them as part of the bigger picture of Westland and Oregon City redeveloping the waterfront there. So I'm happy to put my name forward to I think it's Senate confirmation.
Okay. Yeah, that's what I would propose, just because I feel like the lists are pretty long. So if you're comfortable taking that on, that would be wonderful. Is there any other position that we need to clarify? No? Okay. So we'll clean that list up and then vote on it next week, you said? Okay, perfect. Okay. Is there any more discussion about that for our work session? No. So we will end the work session and move on to item G, department updates. We have none. Item H, the consent agenda, we have none, which I think is a first for me at least. And moving on to old business, item I, consideration of submitting a letter of support for Senate Bill 3126, allowing the agreement that governs the Confederated Tribe of Grand Ronde's ancestral hunting and fishing rights to be updated. And this was continued from December 23rd, 2021. And Commissioner Cooley, I appreciate you allowing me some more time to look at that. I did speak to their lobbyist, Justin Martin, and he gave me a long list of information to read up on. So that was wonderful to see. And if you wanted to move approval, you're welcome to, since it's your item.
I move approval. Though, first of all, thank you, Chair. Thank you for doing that work. And I'm glad Justin probably gave you so much information. Yeah. And this is, I think, an important move forward in making sure that we're listening to our tribal partners. So I move approval of the letter of support for the U.S. Senate bill calling for the change in the hunting and fishing rights of the Confederated Tribes of the Grand Ronde and the Siletz. Thank you.
Okay, and just to clarify, this will be sent to the governor as well as our congressmen and women.
That's correct. Yes.
Congresswoman Bonamici and then Senators Markey and Wyden. Okay.
Yeah.
Okay. Any further discussion? No? All those in favor say aye.
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 Aye. All those opposed? Okay, motion passes. And we are moving on to item J, other business. J1 is the consideration of the reappointments of Dave Poggeberg and Bob Andrews to the Parkway Committee, each for a 4-year term to expire January 15th of 2026. And is there any discussion on this particular item, other than we really appreciate their support and their amazing work in the county? No further discussion? Commissioner Stuart?
No, I'm just waiting for Commissioner Kula to make the motion because it's his baby.
I needed to get the right letter. I move that we approve item I2.
Okay, any further discussion? All those in favor?
Aye.
Aye.
Aye. All those opposed? Motion passes. And we're moving on to item J2, discussion of the West Valley Fire District and Confederated Tribes of Grand Ronde proposed ambulance service area or ASA contract addendum. And this is Commissioner Starrett's item, but briefly, we've been told that there has been some agreement between West Valley and the tribe to cover the entire ASA. And so Commissioner Starrett, did you want to give us an update on that part?
I believe that County Council would like to weigh in first.
Okay.
So the initial thing I was going to say is, Commissioner Cooley, you moved for approval of item I2. It was actually item J1, just to clarify for the record. That was the item that you had just approve the reappointment of those two.
Thank you.
individuals.
Thank you, Christian. I know I was switching back and forth between, and I should just have it up on the screen, but I couldn't see your smiling faces then. Thank you, Christian.
I want to clarify that for the record. Yeah. As to the West Valley Fire District, in the packet, you'll see a letter from the chair of the West Valley Fire District, and as well as a copy of the emergency services agreement that West Valley entered into with Confederated Tribes of Grand Ronde earlier in December to help them continue to provide ASA services in ASA Area 4. The letter refers to a contract addendum, which will further clarify the fact that Grand Ronde is now going to be covering the full ASA area. Previously, there'd been discussion about dividing the area between Grand Ronde and Sheridan. We don't have the addendum yet, but we're expecting that the addendum will reflect what's mentioned in the letter. So I believe this was placed on the agenda at the request of Commissioner Stuart. So if there's any more you wanted to say about this and where we go from here, I'll just also add there is an ASA committee meeting scheduled for tomorrow where I expect this agreement, the letter, and the addendum will also be discussed by the committee.
Yes. Basically, the letter outlines the fact that nothing in this addendum would relieve the West Valley Fire Department from any of the responsibility of maintaining that ASA, and they'll provide all of that information to the tribe to be able to continue that. So that has nothing to do with the greater discussion we're going to have about just reviewing our larger ASA plan. But just some backstory on this, that Commissioner Pope has submitted this to his board because we sent basically joint letters requesting some kind of a revision. And so that went through. They're not going to be putting it before their ASA board. And what this letter is today is just an acknowledgement that I want to respond to their letter and acknowledge their letter. While we don't have the actual addendum in front of us, the letter outlines it in specifics. So the question before the board, I guess, Chair, is do we want to go ahead and approve this letter as a board to acknowledge that we've received it and we're okay with it? And then tomorrow at the ASA meeting, just basically say, hey, this is what this is all about. We have sent back to them that we're in agreement. So that's the question before the board. Do we want to send that letter, or do we want to wait till after the ASA meeting tomorrow? I don't see that there's going to be anything materially different when we receive the actual addendum. My recommendation would be to send the letter and then to just brief the ASA tomorrow. It's up to the board.
Thank you, Commissioner. I agree. I think that's a good plan. I do think there will be a lot of clarification happening tomorrow, which is good. But sending an acknowledgement sounds like a good next step. So, Commissioner Kula.
Yeah, no, Chair, I agree. And I want to thank Commissioner Stuart for continuing to be on this and for working with Polk County Board of Commissioners as well.
I just want to say, thank you, Commissioner. I just want to say that the tribe and Chief Warden, the tribe, and of course, Chief Hurdle and everybody involved has really worked hard through some very challenging times. And I appreciate that the tribe was there to be able to agree to do this. I mean, they didn't have to. They really did have a commitment to the greater community. So at least this is a 3-year base code on shoring up emergency EMS and fire services.
Right. Absolutely. And they put all this into motion very quickly to be able to cover an ASA that size. So we appreciate that. Do I have a motion to approve the letter?
Motion to approve the letter to the West Valley Fire District to approve the contract addendum for fire and EMS services, which will be provided by the tribe, the Confederated Tribes of the Grand Ronde.
Okay, so there's a motion. Any further discussion? Okay, all those in favor say aye.
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 Aye. All those opposed? Okay, motion passes. Thank you.
And Chair, I'd just like to note that it's really interesting that we're talking about reinstatement of tribal rights and also their good work. So clearly really good partner all around.
Absolutely, I agree. Okay, we're moving on to item J3, which is discussion regarding COVID-19 information contained on Yamhill County Health and Human Services website. And this was an agenda item that was added by Commissioner Stuart. And it looks like we have Director Manfin joining us here, as well as Dr. Koenig, I believe. And Commissioner Stuart, did you want to kind of kick off this discussion?
Yes, thank you, Chair. Well, I wanted to say thank you to our Director, Lindsay Manfin, and Dr. Koenig, and for the entire team for the work that they've done the last year and a half. It's been an enormous lift. Yesterday, I was on a meeting, the Family Wellbeing Council, and Dr. Manfin was just pointing out, she said, we collaborate very well and we work very well together. And Yamhill County, I don't think there's any question that we have excelled at collaboration and working with all our different partners, like the nonprofits and the county services boards and advisory groups. What I'd like to suggest today is a proposal that would offer a more balanced approach to Yamhill County public health messaging regarding COVID-19 public health policies. You know, I think that over the last couple of years, that public health narrative at the national and state levels has excluded some pretty credible concerns regarding the impacts of these policies. You know, we've tried to get information on testing accuracy. We've tried to get information on early treatment options and the adverse events, especially in children. And I believe that we need to be more inclusive to the folks in our community who might look at our website and say, it's sort of an echo chamber. We're not seeing anything distinctly different. We're not seeing any of that collaboration because not everybody, you know, believes in what we're being told. So I think it's that lack of confidence in public health is really coming to the fore, because we're seeing that access to more sources of conflicting information is just being completely and utterly blacked out. What I would like to suggest is more of a multifaceted approach to prevention and early treatment of COVID, and acknowledging that there are a number of different perspectives, just like there's no one way that we in this county help people who are dealing with addiction crisis or dealing with their children being sent to foster care. We have a number of different ways and modalities and tools that we use. I think we can do the very same thing in our the health of our community regarding COVID. We should be acknowledging vaccine injuries, that they're real, and address those concerns, because until we start doing that, the people who have been vaccine injured are not going to have a lot of trust in us. And I believe it's important for us to work with a cross section of health professionals, as we're seeing more and more, for instance, the CCO acknowledging that there are a variety of different modalities other than traditional Western medicine to treat, for instance, pain or addiction. And I think we're seeing more of the very well-credentialed infectious disease epidemiologists and physicians and public health scientists that are questioning some of the treatments and the policies. You know, they're coming out of Harvard, Stanford, Oxford, and we're not listening to the wisdom that they would share. And I do believe it's important for us to acknowledge this. Now we're in the third year of these COVID policies, which are having an impact on our children and on people in our community at large. So do we continue to share simply the narrative of Dr. Fauci, who you know, questionable in terms of his transparency and whether he's been truthful, whether or not we look at the alliance between, is there any financial gain? I mean, who gains from the policies that we're seeing between big government and big pharma? So either we stick with these narratives, or do we start including a perspective of those who are actively treating COVID-19 in our community? And there are a lot of them. And considering the input of all these doctors and public health epidemiologists who are looking at some of the specifics that aren't being covered. So what I would like to propose is that we have a panel of healthcare providers in Yamhill County treating COVID patients, along with those who've done the research into this, into early treatment and prevention, and then share their observations with public health and with the community at large through the commissioners, through public health. It's time for us to think in terms of not being just a mouthpiece for OHA, although we do receive funding from them and we are required to maintain the contracts and to be faithful to those contracts, but that doesn't preclude us from looking at more of a comprehensive health approach. So I think we're ignoring critical information. We're not being honest with people. We're not telling them about treatment and prevention. And I would like very much to see us include the naturopaths, the physicians, the researchers in our community who are questioning the narrative, the current narrative, and to look at some of the data that we're not getting out of the, for instance, the VSafe program. There's a lawsuit now trying to get that information. For those who don't like VAERS, let's take a look at VSafe. They can't even get that information out of VSafe. So I think it's time for us to take a look at what else we can be offering, because I don't think we're doing our community any service by just focusing on one narrative. Thank you.
Thank you, Commissioner Stuart. Dr. Manfin and Dr. Koenig, and I hope I'm saying that right, Dr. Koenig. You know, I've seen a shift, I realize that we've been focused on the vaccines and promoting those over the past year and a half. But I've seen a shift in the population, and you might have seen this as well or noticed it recently, but you know, more and more vaccinated people are getting COVID. They may not have it as severely as someone who wasn't, but they're still concerned about their health. They're still concerned about getting it. They want to know how to strengthen their body, how to you know, prevent it in the future. And that's certainly been shifting here in the past couple months, at least that I've noticed. And what's frustrating is that I know we've had these conversations, Dr. Manfin and I have had these kind of back and forth conversations as well about promoting supplements and promoting things, especially vitamin D, which we know consistently has been an issue for people getting severe COVID. We talked about COVID kits, right? Having potentially sending kits from the county to high-risk households that have, you know, suggestions of supplements or have samples, or you know, teach them what a pulse oximeter is and how important that is if you do get COVID, to try and keep yourself out of the hospital. So you know, we've been having these discussions for a while, but I do think it's interesting that we have the narrative in the community has shifted pretty rapidly over the past couple of months, and people are starting to focus on that more because they're seeing that the vaccine is not the be all and the end all, and you can still catch and transmit the virus. So Dr. Manfin, I'm kind of curious about your thoughts and reaction to this discussion.
Yeah, absolutely. And thank you for asking me, and thanks for inviting me and Dr. Koenig to be part of this important conversation. And sort of a lot to unpack there in terms of the information you all shared. So I think I'm gonna try to touch on the various pieces that you brought up, but certainly I want to make sure to circle back if there's something that I don't mention that you want to dive a little deeper into. And I think my recommendation right now is to maybe start with a sort of general overview of what is happening at public health, because I do think that there is a lot more work happening that isn't getting the publicity that other things are. And I think part of that is because some of the other work is perhaps less controversial, and so it's causing less community conversation. And it doesn't mean it's not important, and it doesn't mean it's not happening. It just means that it's not as perhaps publicly facing, or at least catching other people's attention in a way that they are you know, bringing it up through various mechanisms, whether it be social media or whatnot. So I'd like to start with that. And I'll say absolutely, certainly a huge focus of our work is related to vaccines and continues to be related to vaccines. So I don't want to, try to say that that's not the case, because absolutely that is. And I know you have heard me say it before, and I will say it again. I really do think that that is the best way to prevent COVID infection, and certainly severe COVID hospitalization cases, or unfortunately even deaths. So, and we do have that data locally, and the data that we see locally is definitely indicative of that. There's always a little bit of a delay in our hospitalization data that we get, and so the information that I have is current through November. That really does demonstrate that there is significant increase, particularly in hospitalizations and deaths of individuals who are unvaccinated than those who are not, and also case counts. Now, we are not seeing a real change yet in the number of breakthrough cases that we're seeing locally. We're still hovering between 25 and 30%. Now, given all the things that we know about the new variant, I will venture to say that likely will change. And I do anticipate us seeing more breakthrough cases, right? So we're not seeing that locally yet. And I think that in all likelihood, based on what we're seeing, that we probably will. So we'll obviously continue to follow this data very closely. But wanted to just provide a little bit of an update on sort of that data from a local perspective. But again, like I said, there's a lot happening outside of the vaccine work within public health. And so maybe I'll start by just touching on a bit of that. Certainly we're ramping up testing and working very hard to make sure testing is accessible to everyone in our county in a timely fashion. That is more challenging every single day as we're seeing a flood of new people wanting and needing to get tested, but we're working very hard. That team is working very hard to increase it with the goal of ensuring that people have access 5 days a week somewhere in the county. It may not be in every location in the county, but somewhere in the county 5 days a week. We're really working up to that, and we're getting very close. So very, very focused on that. Many of you are hearing as well that there are the rapid tests that are going to be coming to us. We still don't know the quantity or when exactly we will be anticipating getting these test kits, but we are working on our plan for distribution of what that will look like, so that at the moment we get those in, we are able to get those out the door to the people who need them as quickly as possible. Part of our process in doing that planning is working with our community advisory group, because we really want to make sure that we're not leaving particularly vulnerable populations or people that are at most risk out of that process to be able to access those tests. I will say right before the holidays, before we had the announcement that there will be state tests coming to us for the distribution into the community, we went ahead and purchased some of our own, because we decided that was a really important piece of being able to keep people safe in our community. So we had taken that initiative, and those test kits are beginning to come into us. Right now, we purchased them really with a couple of critical populations in mind. And so that's where those tests are going currently. And we are working through an organization you all are familiar with, Unidos, to really target individuals that we have seen hardest hit with COVID, that are often working in conditions where they're in close quarters, potentially not a lot of ventilation, things like that. So high risk places of employment. So we're getting those out, and then working with our shelters, our homeless shelters, where we've got people living in these congregate settings, especially now as we're seeing more of our warming shelters open, which is critical and important. We want to do that as safely as possible, so that if someone does test positive, they can be in a separate area. So that's where we're deploying those tests now. But again, we are working on the larger plan, because the amount of tests we anticipate getting from the state is going to be substantially larger than the amount that we purchased to deploy to those organizations that I just mentioned. And then we are also working very closely with our healthcare providers. That includes our hospitals, our primary care providers, and honestly, it does include naturopathic physicians. Mary, I just want to make sure that Commissioner Sarah, that I mentioned that we do have some of those individuals that are part of this work, that are part of these regular conversations that we're having, because I agree with you wholeheartedly that we need to have a comprehensive perspective when we're having these conversations. And I think that naturopathic providers often bring a different lens, and we want to make sure that we're taking that into consideration. So we are working really closely with our healthcare providers and our hospitals on an ongoing basis. Most recently, right, having conversations about the new antivirals and what those might look like and how those will be distributed in our county. We still don't have a lot of information about that, but we anticipate getting more information in the next couple of days around where those antivirals might be going and public health's potential role in ensuring our community has access to them. An example of that was the monoclonal antibodies, right? For initially there was no access in Yamhill County for that, and we heard from healthcare providers and we heard from you too, our commissioners, that was not acceptable, and we agreed completely, right? We need those resources here locally, and we were able to work with our healthcare providers to get access, at least some access in multiple areas of our community to make sure that people had some level, right? If we are limited by the quantities of that medication coming into the community, but you know, we do have some and are continuing to work on that. And so we anticipate doing the same type of thing with antivirals as we're able to make sure that we've got coverage for people in our community, and that healthcare providers and that people know how to access that. And I will say, you know, information on monoclonal antibodies and things like that really are on our website, and I'd be happy to kind of look through our website with folks if that would be helpful at some point. And then lastly, just want to touch on the areas that both you, Commissioner Stuart, and Commissioner Bershauer mentioned around sort of, you know, summarizing and paraphrasing here, but generally boosting your immune system, right? How do we keep people healthy and safe from the root cause in terms of having a healthy and functioning immune system? And this is not something new to public health, right? Public health has been around for a very long time. Most people hadn't heard of us until COVID, but we've been around a long time, and a large and significant component of the work at public health is looking at things like chronic disease prevention, finding ways with our community to just help our population be healthier. And so there is a lot of history in public health in advocating for the things that we know help keep people healthy. Those are things like getting enough sleep, maintaining a healthy body weight, you know, physical activity, being outside, eating nutritious foods, getting those leafy greens in, right? All of those things are we know that those are critical and important. And we know that in some cases, supplementation is not only a good idea, but in some cases, right, it's necessary to maintain that health status. And we also know that I can't just make blanket statements about, say, you know, this or this related to any specific supplement, because there are unique differences in individuals. And so the message that we have shared, and we've got numerous examples of this through our social media page, and then we also have information about this on our COVID-19 webpage around things like vitamin D, and it provides information about, you know, the anti-inflammatory impacts of vitamin D and the way that it can help support a healthy immune system. And then it does say, you know, you should check in with your healthcare provider. Most places that I see that talk about health vitamin D, whether it just in general in terms of overall health or things specific to COVID-19, really do recommend that you get your levels tested and that you talk to a healthcare provider about that. And so that's the approach that we've taken. But I do think that our website and the information that we have been putting out has not been exclusive of any one COVID-19 mitigation strategy, because any one COVID-19 mitigation strategy is not going to be effective, right? We need to have a multi-layered approach. And so I think that looks a number of ways, because the more layers of safety you have, right, the more likely something's going to catch and not get through. And by not get through, I mean not get through and make you sick or make someone around you sick. And so if you've got a vaccine, that's going to stop a lot of it. If you've got a mask, that's going to help. If you've got this healthy immune system, that's going to help. Right? All of these things are important. And I think using that multi-layered approach is critical. And so I think that's what we've tried to do. And that's the message that we've put out. That's information we've shared on our social media. I think almost every time that I can think of being in front of a public audience, I feel like I'm always talking about, your immune system and those ways that you can boost it. And then certainly we have that information on our webpage. And I think what would be really valuable or helpful for me, at least, is to have some more specific information about what might be missing on our website. You mentioned sort of the VAERS data and information, and certainly we have information on how to access that in there. But the vast majority of our website, as it relates to vaccines, COVID-19 vaccines specifically, is really logistics. It's not necessarily even, in many cases, not even promoting the vaccine. Although, again, I do encourage the vaccine. But our website itself is talking about logistics. It's got information about where you go to get the vaccine and who is eligible. And then, as I mentioned, the other information around testing, the information about how to have a healthy immune system, all of those are connected onto our COVID-19 page. So I think what would be really helpful is to understand maybe more specifically about what would be what you would like to encourage adding or modifying, if I may.
Thank you, Dr. Manfin. Commissioner Cooley, you had a comment?
Yeah, I just wanted before, and thank you, Director Manfin. I didn't mean to jump into a question, in between a question that you and Commissioner Stuart, not Chair Stuart, had, may it be answering, to just observe that in my role as liaison to Public Works, when folks have a proposal that comes to me, I check in first with Public Works, staff and management, but if it's something that people are determined that they want to have a change in policy or language or a proposal or program, what I do is I bring them to our Road Improvement Advisory Committee. And I felt like that's been a really effective way of having experts in the area who we've said, you're our advisors on this area, to hear that, and then to provide a recommendation to Public Works. And so from my perspective, that would be, if you have providers that you really want to have share their knowledge, going through the Board of Health would be what my recommendation is, to have them present public comment to the board. So I just wanted to jump in there with that, recognizing that this is an important conversation about wellness and public health, and the difference between public health and like that physical health provision that Dr. Koenig does on a regular basis. All right, thank you.
And Commissioner Kula, are you referring to Commissioner Stuart and the process, or something else?
Yes, that I think that just as I said, our liaison responsibilities, we have advisory committees that advise both the commissioners and the departments, and that I think the best route personally would be for if there was a group that wanted to provide their expert advice, that they would start with the Board of Health.
Okay, thank you. I mean, I in response to that, I feel like Commissioner Stuart's been having these ongoing discussions for 2 years now, so I'm not sure how different that would be. But in any case, every doctor wants to promote prevention, healthy prevention, and healthy living. So I'm not really sure that would yield anything different.
Well, Chair, I would just remark that the proposal, the very specific proposal that was made by Commissioner Stuart, was to to convene a panel of people who were providing care to COVID patients in the community and have them advise public health on what to put on their website. And my proposal and my ask of you, Chair, and of Commissioner Stuart, is to have these people, if they exist, come to the Board of Health and have that be the proper process. That was the specific request that was made in the preamble to this discussion. Thank you.
Thank you, Commissioner Kula. So Dr. Manfin, just for clarification, we as a public health entity, we see sick people, we see people with COVID. So when we have a situation like that where someone is positive for symptomatic COVID, what are we telling them? Are we giving them a list of supplements? Are we giving them advice? And if we are, then why isn't that advice good for the general public?
So I am the contact that we have with positive COVID-19 patients is through our case investigation process, because we don't provide that type of clinical care within our clinic setting. So just as a making sure the context there. So our contact is with the case investigation process, and the latest data that we looked at showed that we're able to reach about half the cases. So about half the people we're able to call and they answer. And by that, I mean, we actually are one county that has been able to, throughout this, even those surges, at least make 1, 2, or 3 attempts to call each positive case. And if we don't reach them, we send them a letter that has their information. That says, that they had a positive lab result, and this is it really is, it's an isolation quarantine letter. So out of those 50% that actually we do reach, meaning, they answer the phone and we're able to talk to them, generally they're going over the isolation and quarantine requirements. They're asking if they're doing okay. They're asking and sharing any information around, symptoms that they need to check with their healthcare provider for, and then they are also providing or asking them if they need any financial supports. So if someone can't work for the isolation period, are they able to maintain rent? Are they able to access food? Many people are like, oh, I'll just have, fill in the blank grocery store deliver things, but there are people that don't have access to that. And so we coordinate to make sure they have food that gets delivered to them and things of that nature. And we have funding streams that allow us to do that. And we have partners throughout the community in terms of community-based organizations that do that. Now, I will say, as we have surges in cases, those conversations get shorter and shorter, as you can imagine, because we have far more people to call than we have time for, and so those conversations may be shorter. But we are not giving any specific health advice around medications or anything of that nature in those phone calls. But we're really directing them to a healthcare provider for those types of clinical treatment conversations, or if they don't have a healthcare provider, certainly we can try to get them connected to like our federally qualified health center or things of that nature. So hopefully that answered the question.
Thank you. Yes. Commissioner Stuart, did you want to weigh in as well?
Thank you, Chair. And thank you, Dr. Manfred. Just a couple of things regarding the statement. We don't make a blanket statement about, for instance, vitamin D. We don't make that recommendation or that blanket statement. Yet we don't make a blanket statement about something that the body absorbs outside every day when the sun is shining, that has been around for thousands and thousands of years, and we know the safety and the efficacy of that. What we will make a blanket statement about these experimental biologics being safe and effective, which is a term that is used over and over on our website through links to the CDC and OHA. We're making the blanket statement that something that has had an enormous number of adverse events. We're telling people, kind of about one size fits all, that we certainly wouldn't tell everybody to eat peanuts, and we certainly wouldn't tell everybody to take aspirin, because we know that there are some people who literally could die from those things. Yet we are making a blanket statement to people and now to parents of young children to tell them to take something. And that is a blanket statement we're making. So what I'm saying is that if we are doing that, and I think that we are doing that, and that it is causing damage, nevertheless, we're getting paid to do that. Follow the money. The money is coming to us to promote vaccines. We're doing that. What I'm suggesting is that we also give people information about some of the downside and some of the very real risks associated with this, and not bury it in the website. And then the fact that we're not even calling out how obesity is impacting our marginalized communities. If you look at the number of people, African Americans and Asians, who have really, really bad COVID outcomes as a result of some of the effects of, for instance, in the African American community, if we care so much about saving lives, We need to be talking about body mass index and how that relates to all of the things that cause people to really have bad outcomes. So, you know, giving people a vaccine and telling them that's the answer, instead of being honest and saying, obesity is really contributing to your bad outcomes. That's what I'm saying, is let's have a more comprehensive approach. That's all.
Thanks, Commissioner. And I would just note that the difference between me being able to say, you know, here is this vaccine and the recommendation is because that has gone through significant clinical trials where we know the exact dosage that's been reviewed and given, and we have a wealth of information about that. And part of that information is the risks of the vaccine, which I do not. I very respectfully disagree that it's buried in our website. I think it is the emergency use authorizations are there. We have information about myocarditis is there. We have links to the CDC website about specifically about kids and vaccine risks. So I disagree that information is not available to people through our website, because not only do I think it's available, I think it's apparent, and it in fact takes up the vast majority of the content on the website for us is those risk factors. So I really do think that is available to people through our website, and I think that it is accessible, assuming someone can access our website. And I would say you are absolutely right about obesity. 100%, that is an incredible risk factor. And again, I hear that all the time, and I hear that in the media, and I hear that talking. And we know that behavior change is incredibly hard, right, for individuals. And so I think there is a lot of public health work that can happen and should happen related to obesity in general, right? And that work is very slow moving because behavior change is slow moving. And we also know that there is a lot of policy in our state, in our nation, that really influence the ability for people to make healthy choices. And we live in a community and a society where healthy choices are not easy. Unhealthy choices are far easier for people to make. And that's where I think policymakers can be incredibly valuable and influential in helping create policy that make healthy choices easy choices. And I would love to spend more time with the board at some point talking more about that. And perhaps that could be some of the nutrition work that I know is happening through public health that I know Commissioner Stuart, you've been part of as well. And I see Dr. Koenig keeps taking himself off mute, so I want to pause and make sure that I let him speak too.
Go ahead, Dr. Koenig.
Well, thanks a lot for having me today, and I just make a comment about that. And again, enjoy the conversation. And Lindsay Manfin, Dr. Manfin, I appreciate all your comments, and I do think public health has done a rather stellar job, even though that I'm biased and I'm part of that group. I think that one thing you need to understand, Commissioner Stuart, is that you can change your immunization status against COVID today if you want to get a vaccine. I'm not a big fan of mandates. I'm not a big fan of pushing it. I'm a big fan of educating and making sure people have the right choice, in which our clinic that I participate in as a full-time pediatrician and a partner, that we make sure that access is available, and we're not going to stop that. And also that we make sure that those people getting the vaccine understand the risks that's going into that. And I get those conversations every day. I had a nice long conversation yesterday with a family. They elected to go ahead and proceed ahead and get their kids vaccinated based on information I gave them and facts, not necessarily fear and everything else that goes into this, but facts, medical facts that tend to sway that conversation. And they could have walked away without getting the vaccine, and they would have still been my patients, and I still would have been more than happy to take care of them. So to just kind of put that out there, you can change your vaccine status today. You can't change your obese status today. And I know you bring obesity up, but I do resemble that remark. I'm also over the 65 mark. So I have my own risk factors going on here. I do not take vitamin D. I'll tell you that right now. I'm not a big fan of the vitamin D literature that's put out there. I understand it changes things. I understand it has its impacts. It is not a miracle drug. So my doctor has told me that I should take vitamin D. I've declined to do that because I have a dome on the top of my head that collects sun pretty well. So I got all these different things that I think about and that I make those choices myself. So just to be, as far as transparency goes, I think we got lots of great stuff on the website. I was talking to Lindsay the other day and I said, you know, gosh, I should probably go to the website and read it and make sure that I'm comfortable with it, right? And again, lots of things on there. You got a bunch of different clicks. You can go to all different variety of places to get information. And it truly is up to the provider that's supplying that vaccine. And I know public health does too. It is up to us to make sure that the person signing off on that and wanting that vaccine understands the risk that could be involved. And even though the VAERS, as well as those complications that go along with vaccines and vaccines harm, the information is there. The statistics show that you're well ahead of the game getting a vaccine instead of waiting to get the disease and then dying from it. So, or getting sick from it. So the statistics show that certainly is a whole lot more safer than getting the disease. So those are my comments. I think that this discussion should go on. And then Commissioner Bershauer, as far as kits go, again, that's where the health providers come in. They need to talk to, and I worked our acute respiratory clinic the other day. I saw, I think 15 patients in a matter of a very short period of time. Over half of them were positive for COVID. I don't know at the time when I see them when they're positive, right? I hear their symptoms. I take that history. I listen for exposure. I ask about vaccination status. All those pieces come together to say, okay, I just spent 15 minutes with you and you probably have COVID. So I put myself at risk, just like a lot of other providers, including naturopaths who are seeing folks, people in the hospital and emergency departments, the public health departments. We put ourselves at risk every day to take care of these folks. And I do talk about, you need to get some rest. You know, you need to make sure you're drinking plenty of fluids. If you choose to take some vitamins, please keep taking them if that's your choice. But big thing is you get rest, you stay home, and try not to communicate your possible illness with other folks. So all that, those conversations are going on all the time. And it's not just my clinic and it's not just me, but it's everybody that's doing that. And we try to face this infection, you know, hopefully in a universal fashion. And public health is just a piece of it. That's the way I look at it. So those are my comments, and you can ask me some questions if you like.
Thank you, Dr. Koenig. I think that where the frustration is coming from, and obviously we've had this vaccine debate, for lack of a better term, for over a year on this commission, on this board, within each other. So it's an ongoing discussion that we've had. But I think if you set that aside, it feels like there is a lot of kind of a myopic focus on that. And we've moved into a different phase of the virus, right? People who have these vaccines or had the original vaccines are now getting COVID and they have symptomatic COVID. And I think that if we're not shifting our approach and focusing on what to do if you get sick, I mean, I don't know that we have it spelled out like that, right? You can promote vaccines on the website, but are there sections that say, look, here's how you prevent, here's how you keep your body strong and prevent, here's what you do if you get sick. And, you know, I'll tell you, my whole family had COVID last month. We were not, told by our doctors to go home and rest and just drink a lot of water. There was an aggressive plan an aggressive advice as to what to do to make sure that we stayed out of the hospital. So, and I think as we see case counts skyrocket here this month, which they will, because more and more people are getting breakthrough cases, it's our job to put out information and educate people on what to do if they do get sick, because we don't want to overwhelm the hospital system. So that's really where I'm coming from with this. And I kind of see the testing it's very reactionary because, people are testing positive at different stages during COVID. So they might come into the fairgrounds and have a negative test, and then 2 days later they're positive, right? So it feels a bit reactionary, and like we're not quite doing enough. I mean, we've had several of our anecdotally several friends and family who have tested positive for COVID, and it's always the same reaction and the same question. What do I do now? How do I keep myself healthy? What kinds of supplements do I take? You know, what if I start to go downhill? You know, why should I be tracking my O2 levels, my saturation levels? And so there's a pretty specific line of advice that's consistent, whether you're 45 or 18, that I feel would be beneficial to provide to the public. Because once you have this and you're symptomatic, number one, you feel like you can't leave the house, right? Because you're supposed to quarantine. So you're not going to be running into your doctor. And no matter how prepared you are, which my family was very prepared, we still had questions. So I feel like we've had such a myopic focus on vaccines. That's fine. I'm not anti-vaccine, but more and more people are getting this. And I really think that we need to shift somewhat of our focus onto prevention and treatment through other means to strengthen the body and make sure people do stay out of the hospital. Commissioner Cooley, you had your unmuted.
Yes, Chair. I would say that I have directed people and shared all kinds of versions of the Yamhill County Public Health website over the course of the pandemic from March of 2020 through just last week. And I will say that I believe that it is patently false to suggest that Yamhill County Public Health has misinformed or been not done enough. These are folks who are every day working to make sure that everybody in the community is safe and healthy. I will note that you have proposed two different things. One is tell us about prevention, and then tell us what we need to do afterwards. The website could have more information, more details on what to do after you've tested positive. But as Director Manfin noted, when people are contacted through the contact tracing, they are given that information and shared with them. So definitely the second one, there could be more information available for what do I do now once I've had COVID. There is that information on the website, but it could be made more specific. But I will note that while we talk about prevention, it's very clear the data shows, and I'll just say the data shows on our website and in our COVID updates that we receive from our public health director, that getting vaccinated is the best prevention tool. And that is abundantly clear on the website that public health is advocating for this prevention tool. So I want to make sure that when we're communicating to the public, that the public knows that over time, public health webpage has changed to reflect the best available science that's out there in the community, and how people can best approach this. So in the beginning, it was all about what is this thing? It was about contact tracing. It was about how to get a test. And then we shifted over time as there were treatments available and as there were vaccines available. Now, I do think it's very important to note that Director Manfin described for us how the contact tracing conversation goes, that people are asked, do you have the ability to quarantine? Do you have the ability to get food or medicine? Those are very important things for people to know. Right now, I've been advocating with the governor's office that they make COVID leave available to people who have to quarantine or isolate statewide, because that's not something that people are doing right now. So there's a lot of tools that we can use, but prevention, we know the best tool for that is to explain to people the value of the safety and the risks of the vaccines.
Thank you, Commissioner Kula. I want to state though again that we are shifting in this virus and the realities of the virus, and it's not prevention. It's, there's a lot of people who are very upset who received the first vaccine, received the booster, and they're getting COVID, right? It's not a preventative, and actually the CDC has moved away from calling it a vaccine and they're calling it a treatment. So, and I go back to my point of let's not be so myopic about vaccine. Let's make sure people know what to do when they get sick, because there's certain things. I mean, you go from a set of supplements when you're healthy to tripling that when you're sick. Like that's a surprise, right? You ramp up. So that's what I would like to see. I mean, I know Commissioner Stuart has some additional thoughts, but that's what I would like to see is some advice on everyday over-the-counter things you can do to keep your body healthy and safe. And then once you get sick, what can help your body recover faster? I think it's absolutely critical information. And the reality is that we can't say any of this publicly. Like, if you've tried to post any of this stuff on social media, you get blocked and banned for a week. It's ridiculous. So this is our means of communicating to the public that we serve. Commissioner Stuart, did you have additional thoughts?
I think Dr. Manfrin had unmuted. Did you want to respond to something?
Oh, sure. And then, so I think there, as Commissioner Kula mentioned, there is information on our website about, sort of what to do if you get COVID. I think I agree it could be more robust, and that's certainly something that we are looking at and reviewing. And I think there's a couple of other things that are at play that I think are important to note. One being, as you mentioned, things are shifting and changing, right? They're not shifting and changing drastically in our local community yet, but I anticipate they will at some point in terms of number of breakthrough cases and things of that nature. And I think that we need to continue, though, to make sure that what we are providing is information that's rooted and based in evidence. And right now, the evidence is not very clear around a lot of supplementation, increasing, fill in the blank. I think there are some where it's more robust than others, but still, when you look at the National Institute of Health, when you look at the Mayo Clinic, when you look at all of these places that we go to decipher and review comprehensively the literature, when you're looking at hundreds and hundreds of studies, right, and then making recommendations, they are also, all of those places I mentioned, the Mayo Clinic, NIH, they're very clear that there's not enough evidence to warrant that. And I think that as public health, our responsibility is not to provide individualized treatment and care to people, right? That is our healthcare system. We work with the healthcare system. We can help influence the healthcare system, just like the healthcare system can influence us. But we can't make individualized treatment plans in terms of medications for people because we're not getting comprehensive health histories. We're not getting all that information that you get when you go to a healthcare provider who is doing an assessment, who's checking those things. We can provide some level of information, and we have, right? Not just through our website. I think it was back in September, we sent a huge mailer out that talked about signs and symptoms to make sure you talk to your healthcare professional. This is when you call 911. This is when you call a healthcare professional. We've set up a health line with Providence Health Clinic so that people can call and ask questions if they don't have a healthcare provider, or for whatever reason, maybe they want a second opinion. For whatever reason, they might want to choose that. So we've taken steps to make sure people have access to that. And then we've also taken steps for populations that we feel like are probably very much have a more likelihood of being disconnected from those things. And so examples of that is, we have provided O2 monitors and thermometers and information to different homeless camps in our community and things like that to again, those things are happening. Could there always be more? Yes, there could always be more happening. And that's why we constantly have recruitments out for temp staff and other people to come and help us, because all of that takes not only intricate planning in terms of logistics and operations and communication, but it takes feet on the ground to be able to do that work. So I think that there are pieces of that. Can it be more robust? Do I want it to be more robust? Absolutely. I think we also need to be very, very mindful that we don't move into a treatment profile when we don't have the comprehensive information about individuals. And so we really need to look at the generalization of that, and we need to make sure that those generalized pieces of information are rooted in science and information. And I also just want to mention, because this has come up a number of times on this, and I hope that I will have more information in the coming days, but I think Commissioner Bershauer, when you say, things are shifting, things are changing, you're 100% right. And there have been conversations that have been happening for a while now between local public health administrators and the Oregon Health Authority around the approach that is happening related to case investigation, contact tracing, what should the priorities be, what happens when we are at, when community spread is so wide that you're not able to call all of these people. And I think my hope is, and what we're hearing is that very soon there may be the ability to make some of those decisions on what that looks like at a local level. And when we have that opportunity, I would really like to create a proposal to bring back. And I think it's important to get our Board of Health's input on. I think it's important to get our community advisory group input on, and then certainly you as our local elected officials to get your support and to hear from you if you think our approach is correct. And I just mentioned that, and again, I don't have details, but I just want to acknowledge that yes, things are changing rapidly, and I believe they will continue to change over the course of the next week to 2 to 3 weeks for sure.
Thank you, Dr. Manfrin. I think that's why we're having this conversation. At least I assume that's why Commissioner Stuart brought this up, to make sure that we are having a robust discussion and that it is more focused on prevention rather than being reactionary and waiting. Supplements have been around for a long time, and the whole reason they exist is because they are derivatives of the food that we eat and the natural vitamins that occur in fruits and vegetables. And so I don't see for promoting people to eat healthy, we're promoting them to eat healthy because we want them to have a more balanced nutrition and vitamins. And so I really don't make that connection with the supplements. And I understand that people react to different things. I'm one of those people where I have to take them at certain times, but I don't think that giving general advice about supplements, or maybe just a basic list of what might help you to prevent or deal with symptomatic COVID is beyond our capacity or what we should be doing. And I think in terms of making that more robust, we know that dehydration is a big problem. And by the time you're dehydrated, it's too late. You need to go to the hospital. So having some language about that. We've talked about the tracking your O2 levels, pulse oximeter. I tell everybody, I highly recommend getting one of those for your family, just in case, because again, once you get to the red zone, it's too late. So I think that there are ways to make this more robust that is not giving direct advice. Obviously, you'd preface it by saying, look, if you have your own individual, different diseases or autoimmune problems or whatever, obviously seek advice from your doctor. But here's some general thoughts based on all of the cases that we've seen and people who do become severely sick. Commissioner Stuart, you had your hand up a while ago. I wanted to make sure you got in here too.
Thank you, Chair. I just wanted to, I remember quite a few months ago, I had brought up my concerns that we were seeing some of the VAERS data was showing that there were menstrual irregularities. And I brought that to your attention, Dr. Manfrin, and you said it's not borne out in fact. And now the National Institutes of Health is actually investigating this because there have been so many cases of those types of issues. Pfizer, the FDA has refused to release the information on the Pfizer data, and they are asking for 55 years to do that. Now, when we see that kind of information, it really speaks to a lack of transparency. So if we're going by, we are basically going by the marching orders of Dr. Anthony Fauci, who I think enough people are concerned about, well, what this man has done and his ties to big pharma. So if that's where we get our marching orders through OHA in this type of, this is the science and it's settled, I think we need to be able to share with people that in terms of keeping and building health confidence in public health policy, that we do not necessarily say we're going to go in lockstep with what Anthony Fauci and Pat Allen at OHA, who sat here on a Zoom call and told us a year and a half ago that the vaccine was FDA approved when it wasn't. So I think what we need to do is we could have this discussion all day long. We're not talking about being anti-vax. What we are talking about is being pro, let's say, use the term pro-choice in terms of what options are available and putting that information on the website. And when I talk about having a panel, I'm talking about having someone and a group of people outside that echo chamber, the echo chamber that says, get vaccinated, and perhaps you don't want to necessarily go near vitamin D. What I'm saying is we should have a section on our website that says something else you might want to consider. That's all I'm asking.
Thank you, Commissioner Starrett. Just for clarification, do we have a naturopathic doctor on the Board of Health?
Yes,
And that was 5 years. It took 5 years of 4 years of suggestion to try to get that to happen. I brought that up and brought that up and brought that up, and it was a fight.
That was, I feel compelled to say that was not my experience in terms of being both the Deputy Director for Health and Human Services and the Public Health Administrator, and then as the Director. I felt like we have always been supportive of that. Initially, the Board of Health was very specific that they were looking for some specific representation that we didn't have. And then with our Board of Health, when we brought on Dr. Martin, who has been a fabulous addition to our Board of Health, there was full support in that process. So I'm not trying to be argumentative. I just need to, that was a different experience. I also wonder if being able to show you on the website what we have, it would be of value, because Commissioner Berschauer, when I hear you talking about the things that you want on the website, I'm looking at it right now, and I think it's there. It doesn't have hydration, granted. I agree. Hydration is great. So I'm happy to add that, but it has eating a healthy and balanced diet with some information. It has getting enough sleep with some information. It's got, information about quitting smoking, limiting alcohol, consider vitamin supplements. That language is there. Some research indicates boosting the immune system with vitamins such as vitamin D and vitamin C. Check with your healthcare provider on how and when to supplement. Here's more information on vitamin D, and then it goes into some of the benefits of vitamin D. That's on our website. And so I think it would feel more helpful for me to have that information reviewed and then provide specifics, like what about adding staying hydrated, right? Like that is because I think what I'm hearing is a lot of that is already on there. And then as far as a panel, I don't know what that would look like. Certainly there are plenty of healthcare providers who I'm in regular conversation with that I would be happy to invite to a conversation, but I'm not sure what the outcome of that is at this point.
So I think language matters. I mean, that seems very kind of general to me. When I had COVID, my doctors were very specific. You need to watch for dehydration. This is a common across the board problem with people who are coming in and they're in bad shape, right? You need to check your O2 levels and check in and let me know where they're at, because the common denominator with people who are going to the hospital is that they're dropping significantly. That's a different way to say that, right? We're telling people, hey, our purpose is to keep you healthy and keep you out of the hospital. That was the whole point of having these vaccines roll out and the boosters, is to try and reduce the load on the hospital system. And I feel like if you're telling people, here's what we've been seeing in severe cases of COVID, you need to watch your hydration, you need to watch your O2. That's really helpful information. I mean, that's critical information, especially when you're sick. And a lot of people simply don't have access to a doctor that they can text all day long and say, here's how I'm doing. So I just feel like, the language and how it's presented matters. And I don't really think that gets there. When we talk about being more robust, I think we could make that a bit more clear. If you're sick and you have COVID, here you go. Here's what you watch for, and here's how to keep yourself sort of out of the red zone. I realize we're bordering on advice from a doctor, but some of those are pretty general statements as to what to watch for. So I don't think that quite crosses the line. Commissioner Starrett?
Thank you. to Dr. Manfrin's point about, I don't know what that would look like. So my recommendation would be, when I talk about a panel of providers who are actively working with COVID patients and have been able to keep people out of the hospital, or how do you deal with that early treatment? Because early treatment is critical. So if we were to get a number of people from our community, and there are a number of people who are keeping people out of the hospital, and work with them, and in other words, that input to come into public health to say, this is how we're doing it, and this is the information that we might want to share with people, and it could be done on the website. It's not specific, it's overall. It's a way that we can share with people. As Chair Bershauer mentioned, not everybody can call up a naturopath or a health professional who will be able to say, what's your O2 level now? What you should be taking this, you should be taking that. So what my recommendation would be, and it doesn't have to be anything that is extremely divisive in any way, is that we bring some people to the table to share information that they might suggest be on our website from their experience of having treated people. That's all I'm saying. So we can still have the information that says, get vaccinated, here's where you get vaccinated, here's where you get tested. But what I'm suggesting is that we have some people who can offer an alternative approach, because as we know, there's not one size fits all. And when we discount that, I think that's really causing, this is the issue. We're not putting that information out there, and that's all I'm asking that we do, so that perhaps these people can make some suggestions on what we can share on our website. That's all.
Thank you, Commissioner Stuart. Commissioner Kula.
Well, I think it might be good to offer Director Manfrin the opportunity to respond to that. But again, I'm gonna go back and just formally request that Commissioner Starrett, if you have individuals, healthcare providers that want to share their expertise with the county in a way that will affect policy or message and communication to the public, that you bring them to the Board of Health. That's the most appropriate response. I think it's completely inappropriate to suggest that we should put individual providers' recommendations onto a website that's about public health and not about providing care to the whole community. I will want to go back to Commissioner Bershauer was asking repeatedly about prevention, and Director Manfrin actually read from the prevention list. So that's where the vitamin supplements, for example, are on. Then you switched to, oh, I want it on a treatment list. I want water on a treatment list. So right now, the treatment list, I would just want to say that on the website, the treatment list includes the medications that are available right now. So if you're asking Director Manfrin to add stay hydrated to the list of medications that are currently approved, authorized, then that's a very specific request. And I'm not sure if that's the request you're making, but it's going to look really out of place, is to have drink lots of water. The prevention page is all about wellness, about full body wellness, in order to be able to not contract COVID and to have success in fighting it. I just want to note that that's just what the web pages say right now. And I will go back to, I would love to see your panel of experts from what you say is outside of the echo chamber, which makes me uncomfortable if they're providing care outside of the recommended course of care. But if you want them to provide advice, send them to Board of Health. That's the purpose of it. And then we can have that internal dialogue about what's appropriate to put onto a web page.
Thank you, Commissioner Kula. I think we have a naturopathic doctor on the Board of Health, and I'm not sure, I'm not going to speak for him, but I'm not sure he would disagree with anything we've been discussing today. So we already have someone who's representing the community who does believe that these preventative treatments are necessary and could speak to COVID patients that he has treated and some common denominators and things to look for. Maybe that's the compromise, right? Maybe we have the Board of Health and Dr. Martin advise on what should be in this list and things to look for. Again, for me, it's not enough to say stay hydrated. You need to tell people why, right? Dehydration is causing hospitalization with COVID. It's a severe problem. It's something that's, one of those critical issues that you need to watch. That's a very different message. So, maybe that's a compromise that we have Dr. Martin involved in some way. I don't know, Commissioner Stuart, how you feel about that, but.
Well, the only thing that I would say is that, yes, Dr. Martin would bring, I would imagine, a different perspective than what we're hearing, considerably different than what we're hearing. And Commissioner Kula, when you say that it makes you uncomfortable, that we would include providers who had suggestions that were outside of the narrative, the trademark narrative, that anybody who diverts or
Chair, please don't, I'm sorry,
Excuse
please
me.
don't put words into my mouth.
Excuse me, I'm talking, thank you. So if you've got somebody who is, you said, outside the normal treatment plan, were those your words?
Chair, are you, Chair, do you mind if I respond to Commissioner?
Go ahead.
Okay, I'm happy to let you, Commissioner Stuart, continue talking. You put words into my mouth with your quotes of narrative. I don't feel that that's respectful right now, but I will say that public health is different than providing care to an individual. And I repeat that, and this Dr. Martin can work with the rest of the Board of Health, but no single individual on the Board of Health should be making recommendations on their own to the county public health. Okay, thank you.
Well, I think Commissioner Kula, if you look at the perspective that you bring, because over a year ago, you contacted the governor's office and wanted to know what the governor's office was going to do to basically counter the alt-right anti-vaxxers. So that's a perspective that you have, and that is very telling that you're concerned that the alt-right anti-vaxxers might actually get their message out. So I'm concerned about how we juxtapose what your obvious perspective is with a number of people in our community who might not want to be classified as alt-right anti-vaxxers simply because they question the narrative. And the narrative is literally pulling down any kind of contradictory information, not only from the media, but from social media. And you can't get that information out there. And that I think is very disturbing. My suggestion is that we get some of this to counterbalance this echo chamber we have of Dr. Anthony Fauci and Pat Allen and the governor's office, which does not give any quarter to anyone who might say there's a way to treat this.
Thank you, Commissioner Stuart. Dr. Manfin.
Yeah, thank you. So I'm wanting to maybe go back just a little bit in terms of maybe one of the proposals that was put on the table as far as working with our Board of Health, which really is composed of people who are there to provide advisement and recommendations to the Board of Commissioners. So I do think that that's an appropriate body to have conversation with. And I would agree with some of the statements made that we really need to make sure that we are using the entire Board of Health because each person brings their unique perspective and they were selected for those perspectives that they bring to the table that I think are really valuable. And one of the things that we don't actually have a Board of Health meeting scheduled until March, but it has been on my mind with some of these things that are happening so rapidly in terms of how we may need to really think as a community of how we want to move forward over the course of the coming weeks and months as it relates to COVID, to bring that group together sooner than March to have an ad hoc meeting. And I think that this could be part of the conversation there if that feels appropriate to the Board of Commissioners. I want to say I don't know that there is as much disagreement as perhaps is being maybe felt in this meeting. I think that there absolutely are things that public health can share that are generalized information that we do share and maybe not well enough, or maybe it's not prominent enough, and we can work on those things around I mentioned the flyer we sent out to every address in Yamhill County, just about signs and symptoms to watch for, and when to connect with the healthcare provider, when to connect with 911, those types of things, right? And I think that we can continue to build on those things and talk about, the things that we know everyone should be watching for with any respiratory virus, whether it's COVID or something else, because there's nasty stuff going on right now. We're seeing RSV, we're seeing flu, right? But a lot of those early at-home care, it can be quite universal in that way. Once you get to more severe stages, right, I want to make it clear that there's very specific treatments for very different things. But when we're talking about some of that at-home early, respiratory care, where, whether it's staying hydrated, watching for signs and symptoms, especially in little ones around, what does their breathing look like, and those types of things. We can definitely do that and provide more robust information. And I think we can do that without crossing the line of being so specific that it's becoming some sort of like individual's care plan, because that is something we can't do and shouldn't be doing. But I think that there is a way for us to incorporate more of that type of work into our messaging and information that we're sharing with the community. And I also want to make sure that we're not pinning any one particular area of medicine into sort of a pigeonhole, if you will, stating that all medical doctors or doctors of osteopathy are in one category and they're at odds with naturopathic physicians, because I don't think that's the case. We work closely with a number of naturopathic clinics, and they on all sorts of things, including vaccines. Some of them offer vaccines, right? So I think that there's a spectrum of things, and I would hate to see us categorize things in a way that's not necessarily helpful to our collaborative work. And Commissioner Stuart, you started this conversation beautifully with talking about the wonderful collaboration that happens in Yamhill County. And I think that happens in the medical community and with public health, and HHS is part of it as well. And I think it spans the sort of traditional allopathic medicine into naturopathic providers as well. And I see that in my work, and I'm very grateful that I get to see that in my work, because I think it's critical that we are creating space for all of those conversations. And so I think that having the conversation, if there are additional things that we want to have specific to that at the Board of Health as part of a conversation in our ongoing efforts related to COVID, I think that would be very appropriate, and I would be happy to make sure that happens if that is something the board would like.
Thank you, Dr. Manfrin. Commissioner Stuart.
Thank you, Chair, and thank you, Dr. Manfrin. So how about we do this? How about we convene the Board of Health sooner than the March meeting, because they are few and far between. And then we ask some folks in the community who are medical providers who are treating COVID and perhaps not necessarily allopathically, invite them to come and make public comment and make some recommendations to the board. And then based on those recommendations, we would have the board report back in terms of what that information was and what they would like to see included on the Yamhill County Public Health website.
Dr. Manfrin, does that sound amenable?
Yes, I would be happy to do that. And just, always happy and always welcome public comment on this topic or any other topic to our Board of Health. And I know that the members of our Board of Health are absolutely always happy to hear from our community members, and whether they're healthcare providers or general community members, absolutely.
Okay, Commissioner Kula, did you have anything to add?
No, I was going to say that sounds good.
Okay. Dr. Koenig, I think you positioned yourself to look like you were going to unmute. So did you have anything further as well?
Sure, I think all this is great discussion, and again, my brethren in all different types of medical field are welcome, and I just want to make sure, and I see Christian is there listening as well, but I would just kind of let you know the cautionary tale of don't become an advice center when you can't support the advice given or only on anecdotal information. So you become liable. And I think that if you I think it's great. You're looking at this, making sure everybody gets a say. But if you put something anecdotally on your website that says you can treat and you can take care of this infection with A, B, C, and D, and it is not legitimate, then that's your liability. And I think that you just have to be cautious about what you put on there and what is really substantiated by the research. So just a cautionary tale.
Thank you, Doctor. Yeah, I definitely think we would benefit from this conversation, because I'd be curious to hear the reaction from the Board of Health, particularly Dr. Martin, because I feel like he has staked his entire career on this type of advice, right? So people are directly accountable for the advice that they give. Commissioner Stuart, did you have something to add as well?
Thank you, Chair. Just to that point is that we have medical professionals who have licenses, and that licensure is also something that they guard very carefully, because they have a lot of stake in it. So I think that when we have people who are perhaps not allopath, in fact, I'm thinking of a couple of DOs who also might divert from the typical allopathic thinking, but when you have people who have licenses, they guard those very, very closely. So I think we can have faith in them, and they have been practicing in this community. So what my recommendation would be is that if we have people we would like to include in this public comment, specifically invite them to bring their thoughts, take a look at our website, make recommendations on what they would like to see up there, and then bring that to a Board of Health meeting that we can convene ASAP.
Okay, thank you, Commissioner Stuart. So, Dr. Manfrin, how does that typically work if we try and pull together both boards? How much lead time do you typically need for that?
I think as we were talking, I was thinking through what the logistics might look like. What I think I'd like to do is this afternoon, I can send an email to our Board of Health members with some proposed times within the next 2 weeks to say, and figure out what's going to work for most people. And hopefully we'll be able to get the vast majority of those individuals there. Once we get that meeting time scheduled, we'll make sure that we have, we're within the appropriate notification time for the community. We'll get that information posted on the website, and that information, and I'd be happy to share with folks too. Ken?
Yeah, I just wanted to, I just want to clarify on what's being requested and what we're looking at. Are we looking at convening the Board of Health to have this discussion, or what was being proposed is kind of a joint work session with the board, meeting with the Board of Health and having a larger discussion? I think there was a question there about how to convene and what that process is going to look like. And admittedly, maybe I'm just not tracking very well, but I just want to take a step back and make sure I understood, what we're looking at as far as what type of meeting is being requested to convene.
No, I agree. I think you're right. There's some discrepancy there. If it would be more beneficial to have them on in a work session. Christian, is there some type of legal issues that we're missing here?
I know, waiting for Christian, because I don't think it's necessarily, because the board could have a work session. I guess originally I thought this was convening, because I know that the meeting frequency for the Board of Health is more on a quarterly basis and not scheduled to meet until March. And so looking at having that meeting, having as Lindsay said, an ad hoc meeting, something that's off the schedule, convening an earlier meeting of the Board of Health, that this discussion and invitations would be had. And on this topic, I wasn't clear until the question was raised on whether, when I heard kind of a joint meeting with the Board of Commissioners and with the Board of Health, if that's going to take the shape of a work session, or if this is a separate Board of Health meeting. And then there would be a recommendation or a follow-up discussion that may come to the Board of Commissioners following that meeting. Or, again, I'm just trying to clarify process a little bit. Sorry, Kristen, I cut you off.
Chair, I would just recommend that the Board of Health meet with whoever wants to provide public comment, and that they send on whatever recommendations to the Board of Commissioners.
Commissioner Starrett, is that satisfy what you were hoping for, or were you hoping for more of an interactive with the board?
Well, I think there's a lot of wisdom in letting the Board of Health receive public comment from specific practitioners. And then based on that, and I am the liaison to the board, not a voting member, but a liaison to the board. But I'm wondering if the other commissioners, if it was noticed and the other commissioners wanted to listen to the meeting just for edification, that would also be an option, but that it would not necessarily be a joint meeting. If that would get a little bit too confusing.
Yeah. Christian?
I mean, the only other thing I would add to that is whenever we have conversations about how to set up future meetings to allow public input, we always sort of get close to the line of, well, is it a work session of the board, or is it more of a public hearing, and how the board wants to approach that. I don't get the sense that the board is necessarily looking for either the Board of Commissioners or the Board of Health to schedule a public hearing to hear from the public generally. It sounds like you are looking for some more focused input from some particular individuals. In that case, it seems to make sense to me that you would have the Board of Health meet, ask in advance for some folks to provide some input, and then if the Board of Commissioners wanted to attend, that's not a problem as long as it's properly noticed. And then if from that the Board of Commissioners does decide they want to hear from a broader cross section, to then schedule either a follow-on public hearing or a follow-on work session of the Board of Commissioners.
Okay, I think that sounds like a good plan. Dr. Manfin, does that give you the info that you need to proceed?
Yes, it does. Thank you.
Perfect. Okay, any other discussion, commissioners, on this topic? No? Okay, well, I appreciate the very robust conversation. We've had several of these, but I do think that, as a baseline, we just want people to stay healthy and survive this, right? Whether we agree or not on the treatment or the plan, I just keep going back to the fact that knowledge is power. And if we have the ability to get as much of it out there and empower our residents about how to tackle this as we move through the stages, right? We're going to move into endemic at some point. So, how we empower them to make sure that they're taking care of themselves and that they know what to do in the situation that they get it. So I appreciate the discussion, and thank you, Dr. Koenig and Dr. Manfred, for coming on. Whoops.
You're welcome.
Oh, there we go. Not gonna hear. All right, take care.
Thank you.
Okay. Let's see. Where am I?
I think
So,
we're at
Chair.
J5.
J4.
J4.
So we are on to item of other business J4. Consideration of the approval of grant agreement number 21-536 between Yamhill County and the state of Oregon Office of Emergency Management, OEM, for the Emergency Management Performance Grant, EMPG program, in the total amount of $112,598, retroactive to July 1st, 2021 through June 30th, 2022. And Ken or Christian, do we have any additional comment on this particular item?
No, I don't have anything to add unless the board has questions. This is similar to the agreement. I reviewed it. It's very similar to the agreement that the board approved for emergency management in the last biennium.
Okay, commissioners, any further discussion?
I would move approval, Chair.
Okay, so we have a motion to approve item J4. All those in favor, say aye.
Aye.
Aye. All opposed, same sign. Okay, motion passes. And I believe that's the last of other business. So we're going to move on to public hearings, which we have none. And that brings us to announcements. Commissioner Starrett, any announcements?
Yes, I just want to say we met with the Northwest Senior Disability Services Board and we ratified the contract with the employees. It's going to cost a significant increase for payroll, but everybody else is experiencing that. We needed to do some employee retention cost of living types of changes. One of the really disturbing things is that we're seeing a number of long-term care facilities that are closing down, which leaves us with people in critical need needing housing. And so there is no place for people who really need a lot of care, a lot of seniors to go. So we're struggling with that. And it's just one of those things across the board in multiple counties that everybody's, you have a couple of facilities in Lincoln County closing down and Tillamook County, and that's impacting counties all around. So we have to be aware of the fact that these are folks who have very critical needs of housing. So that's all I would add.
Thank you. Commissioner Kula.
Yes. So at the invitation of Visit McMinnville, I joined they're going through a training with Travel Oregon in helping them become eligible for destination like infrastructure upgrades, right? Investments in the community that will help bring people to the community, but also will help residents of our county. And so I'll keep you informed as we go through that process. The other thing I wanted to note is that we have MWAC this afternoon, the Mid-Willamette Area Committee on Transportation, and they have a letter, which I believe that Tom Hammer, our other representative on MWAC, sent forwarded to you, that we'll be submitting to the Oregon Transportation Commission. And I will likely be providing testimony as well. And this is with regards to the infrastructure package and the funding that's coming to the state. So I will try to keep you informed as best I can about how that goes down, as it were, including I got a phone call from Mayor Hill while we were in our meeting. So I'll call him back about that, but I will keep you posted.
Okay, sounds good. The only thing I have is that we, the Mid-Willamette Jobs Council met yesterday. Commissioner Cooley, I think you were on that call too. I wouldn't say there was any information that was surprising, kind of the same, the same narrative that we've heard. The unemployment rates are considerably lower than they thought coming out of the last 2 years, which is a good thing, but still having some kind of mysterious, labor issues, people retiring early, people just choosing to stay out of the workforce. So it's a great time if you have teenagers to have them find a job that pays pretty well, but definitely concern long-term as to whether or not we're going to rebound in the labor market, or if we're just experiencing a generational shift. With all the baby boomers retiring and that generation being so large, there's just not enough of the younger generation to come in and fill those jobs. So we are potentially entering into just a new shift of how the workforce operates. But some very interesting numbers and statistics on that call yesterday. So
I feel like I should add to that too, because thank you for reminding me. So much happens in a day, but there were, yes, very interesting information. And there's also, I did raise the possibility of contracting with the Workforce Partnership rather than going through SEDCOR to the Workforce Partnership. So full disclosure, we were both, I raised the subject with Kim Parka-Jaranis. So I did know, and Commissioner Chair, you probably received the email about a proposal of expanding the funding for workforce training that's coming from the governor's office. It's a specific proposal that a large amount of money would go to the workforce partnerships. As you noted, having not enough people in one industry and having people struggling to find to get trained properly for that industry is a big challenge, right? So it sounds like the governor's proposal is to significantly increase that workforce training. So stay tuned. And I'm going to a briefing next Tuesday on the details of it.
Okay, great. Ken, Christian, any announcements or updates?
Well, I was just wondering, there had been some discussion about the board returning to in-person meetings in room 32, possibly as early as next week. So I didn't know if the board wanted to sort of circle back and make some decisions around whether or not now is the right time, or given the increases in cases and some of the other technological improvements that were being made to room 32, if it made sense to maybe talk about it at least and decide whether or not to move forward for next week or possibly push it back into next later this month.
Yeah.
Or next month.
Thank you for reminding me. So Ken and Christian and I talked about this yesterday. I had originally proposed that we go back next Thursday. I'm going to revise that suggestion. I think that we should shoot for February 6th, and a couple of different reasons why. We have a new Carrie Hinton coming on, starting, I believe, January 24th. So in order to help kind of get that person caught up, might need a little lead time on that. We also probably need to do a dress rehearsal just to make sure everything is working properly in terms of virtual public comment and potentially virtual commissioners coming in. So there's that piece. All accounts are that the COVID cases are going to peak this month. So I just don't want to be in a position where, we're having to backtrack and go back to virtual once we sort of make this decision. So my proposal would be that we shoot for February 6th to go back in person. Commissioners?
And I just want to note that we will have no virtual commissioners. We may have some commissioners that are zooming in, but that's
we have a virtual
commissioner sitting over there.
Good clarification.
Just want to make sure.
No virtual commissioners, huh? No, I really wish we could get back into in person. I've had this conversation with Ken and with Christian, and my feeling is that if the county would be put in any kind of jeopardy in terms of being fined for someone who was not wearing a mask, i.e. myself, I don't want to put the county in that position, because it would be one complaint after another, and then having to deal with that. So since I'm not going to be wearing a mask, my recommendation would be that I continue to join virtually, rather than putting our administrator and our county council in the very uncomfortable position of answering OSHA complaints and perhaps $500 per incident fines.
Chair,
Go ahead.
sorry, my comment was a throwaway one. So my substantive comments would be that I think let's set it at a date in the future and then reconsider that when we get closer to it. I think that we should not be meeting in person with what is clearly a very contagious variant around us. And I also just want to make sure that when we go forward, that that Commissioner Stuart, her presence from afar, or her presence virtually, can be such that she is on an equal playing field with us, or equal level, as it were.
Sure. I just want to note that when you said we're all virtual commissioners, my screen went black and it said, "Your internet connection is unstable," and then it popped back up and you guys were all frozen and laughing. It was awesome. I should have taken a picture. But so Christian and I have kind of been having that discussion about how we do potentially protect ourselves from OSHA complaints, because nobody wants that. So we'll continue to maybe have that discussion in the event that we do make that decision to go back. But it sounds like we're all in agreement to push it off at least to the beginning of February. Let's see how the month goes, and see where we're at with COVID and all of that. But yeah, so let's shoot for February 6th, just to name a date, and then we can continue to discuss as things change. Christian?
I actually think that just a slight correction. I think the first potential date in February would be February 3rd.
Oh.
Or February 10th. I think the first Thursday in February is.
Oh, today's January 6th. That's why. Okay. February 3rd.
Okay.
We'll just put it on the calendar for that, and if something changes, then it changes. But
it helps to put it on the calendar.
Yeah. Okay. Anything else for the good of the order? No? Okay. Well, hopefully I didn't screw up too bad with my first meeting.
I think you did great.
Good job.
Okay, we're going to adjourn the January 6th, 2022 Board of Commissioners meeting, and take care, everybody. Stay healthy.
Thank you.
Thank you.
Thanks.
Thanks.